Hello, this video is about osteomyelitis and is a part of the infectious disease series. The following topics will be covered. Osteomyelitis is typically caused by Staphylococcus aureus, including MRSA. Other types of bacteria include Streptococcus or fungi, but this is quite rare. The disease mainly affects the musculoskeletal, often affecting long bones and vertebrae. The method of transmission is often through direct contamination through open fractures, surgery, or implants, so it's a secondary infection, or hematogenous spread through blood, and contiguous spread, where the infection spreads from nearby tissues, for example, in a diabetic foot infection. Infection begins when bacteria reach the bone, causing inflammation, which leads to pus formation, which may restrict blood flow and create areas of bone death, known as sequestrum. Ischemia, which is the reduction of blood flow, leads to necrosis, or death of bone tissue. In response, the body may form new bone around dead tissues. Chronic osteomyelitis may cause recurring infections due to remaining bacteria and biofilms within the necrotic bone, which are difficult to eliminate. Predisposing factors include recent surgery or trauma involving the bone, use of implants or orthopedic hardware, immunosuppression from diseases like HIV or from treatments like chemotherapy, and diabetes. Signs and symptoms. For acute osteomyelitis, sudden and severe bone pain, fever, chills, and feeling ill, swelling, redness, and warmth at the site of the infection are signs and symptoms. For chronic osteomyelitis, persistent or recurring pain in the affected area, drainage of pus from wound or surgical site, and general fatigue with periods of symptom flares. To test for the disease, a blood test is often conducted to check for elevated white blood cells, C-reactive proteins, and erythrocyte sedimentation rate, which indicates inflammation. Bone scans and MRIs, and the bone biopsy to see what type of bacteria it may be causing. Treatments are often antibiotics tailored to the bacteria identified in biopsy. If the situation is really bad, surgery, which may be for drainage, removal of dead bone tissue, or in severe cases, bone grafts or hardware removal. And if the situation is really severe, amputation may be necessary. Complications that may arise include chronic osteomyelitis, bone necrosis, sepsis, fractures, reduced mobility. Prognosis is often good with early treatment, but chronic cases can lead to serious complications. Thank you for listening. If you have any questions, please put them in the comments section and I will answer them if I can.